healthy as you should be. Right, mouth cancer, why should you not miss it? Well, here we go, front page of dentistry again. None of us want to end up on the front page of dentistry, as one of our colleagues unfortunately did, because he'd missed a cancer in his patient, and then he was up before the General Dental Council, who then placed conditions on his practice in that he had to submit every 6 months a written confirmation that he'd undertaken a soft tissue lesion examination in all his patients. So nobody wants to be having to do that. Also, from a patient point of view, then what is the problem? Well, the problem is mouth cancer. Most of it is squamous cell carcinoma. 95% of cancers you'll get in the mouth are squamous cell carcinomas. Some come from salivary glands. But the lining of the mouth, this is a condition when we're looking for it, when we do a quiz in a moment, you're looking for things that arise from the surface epithelium rather than the underlying tissues. So we've got 95% of mouth cancers are squamous cell carcinoma. How many in the UK per year? Well, every time I give this lecture or talk, this number goes up. We are now at about almost 7,000 cases of mouth cancer per year in the United Kingdom, which still makes it fairly rare, but the problem is it's an important, as you will see in a moment, the 5-year survival makes this an incredibly important condition. If we take 100 consecutive cancers, we find that the ratio is about 2 to 1 male to female. But that has gradually been increasing, and the trend is that oral cancer is becoming more frequent in females. They're catching up with the men. With those 100 cancers, if we look at the age of the patients, we'd find 98 of them are over the age of 40, and the same 100 patients, we would look 85 were over the age of 50. So it's an age-related condition, but this year in the unit in Cardiff, we've had 2 does occur in younger individuals, and those 2 individuals did very, very poorly. So overall age-related, but don't exclude it being present in your younger patients. And this is the bad news here. The overall 5-year survival is 50%. If you're diagnosed with oral cancer, you toss a coin, heads you're alive in 5 years, tails you're dead. The 50-50 are the odds of the patient being alive despite any form of treatment. So that is the grim news about oral cancer, is the 5-year survival is very poor. And that has not improved during the past 40 years, despite massive improvements in surgery, radiotherapy and other approaches to treating it. The patients are still dying at the same rate.